Hi, I am Dr. Vishruti Manik, cosmetic dentist and implantologist in association with Save the Tooth campaign. Shall be talking about bone grafts today. Now, what exactly is bone grafting? So when I say bone grafting, it is a surgical procedure that uses artificial bone to rebuild the damaged and resorbed bones. Now, the main function of your jawbone is to hold the teeth. Bone, just like muscles, if you don't use it or stimulate it, it's going to start resorbing or shrinking. So that's why whenever for any reason, say you need to extract your tooth, maybe because of decayed tooth, or there is a loosening of teeth, or there is a trauma, and the tooth has been extracted, then the bone starts to resorb at very fast. And if you're planning for some fixed option such as implant, then the adequate bone requirement is must. Therefore, the easiest, less expensive, and the less painful procedure is when the tooth comes out, at that same moment, you place a bone grafting material, which is nothing but the socket preservation technique. Now, imagine the adequate, predictable implant site is ready the day you remove your teeth. Isn't this sound like a miracle? Yes, it is possible. Now, the other question that comes in my mind is, where do this bone graft come from? So, the bone graft comes from different origin and are of different types. Allograft means the bone graft is taken from the another human. Sometimes the dentist might take the bone graft from your own body and use it as a bone graft, then that is called as an autograft. Sometimes it is from another species such as bovine or porcine, then that is called as xenograft. And if it is synthetically or artificially made, then that is called as synthetic bone grafts. About 60% of implant procedure needs bone grafting. And if you are aware of what it is and what is socket preservation, you can, plan accordingly the day you extract your teeth. But sometimes there are some other reasons as well where the bone grafting is required, such as if you need a denture and there is no adequate bone, or whenever there is a bone loss due to gum disease or pyorrhea, then the bone grafting might be required to save your tooth. Now we have learned about the bone graft, what are the types of bone graft and where it is required. But what is the actual process? So bone grafting, when you go to the dentist, she will take the proper history of yours and then will plan accordingly. First, he or she will give you the local anesthesia so that that area is numb. Once that area is numb, he will extract the tooth if required, or he will give an incision to open up the flap and place the bone grafting material in the socket or in the area where the grafting is required. After this, they will stitch back the flaps with the help of suture. Now, some precautions need to be taken care after the procedures, such as when diet. So the diet should be liquid, soft, and nutritionally balanced for first 24 to 48 hours. Then there can be swelling for first 24 to 48 hours, which can be minimized with the help of cold compress 30 minutes on and 30 minutes off. Then when I say rinsing and brushing, the usually patient asks this question, can I brush? You can brush gently in the area adjacent to the bone grafting material or bone grafting site, but not on the grafting site for at least 1 week. Then let the cloth stabilize for first 24 to 48 hours with no vigorous rinsing or brushing in that area. Alcohol use and the tobacco use should be eliminated for at least 2 weeks. And medications need to be taken properly as prescribed by your doctor. Hope this video has helped you a lot in understanding what is bone graft and will definitely help you to save the tooth. Thank you.